What's up, everybody? Let's talk about gout today. This is a common topic that ends up showing up in the other systems section. It's more common than you would think, but it's kind of weird. So let's kind of get into it. What is the anatomy affected? Joints. Any synovial joint lining in the body is what ends up getting attacked by this swelling, inflammation, and essentially what is called uric acid crystals, which are referred to as trophi. So trophi, trophi. What these end up doing is they're going to crystallize around the joint, kind of like how honey crystallizes if you don't pay attention to it for a couple of days and then all of a sudden you open it and you're like, why is it crystallized? What happened? That's kind of what it looks like on the inside of these joints. So it causes inflammation, loss of range of motion, all of these other things that end up showing up. And the reason why I'm putting the big toe here is because the first metatarsal phalangeal joint, so your first MTP, aka right underneath your big toe, that's the joint that is most commonly affected. After that, you can usually see it show up in like the weight-bearing joints of the knees or potentially even into the ankles and stuff. But this is the most common area where it shows up. And a lot of the reasons why is because it ends up in the blood, pools to the bottom of the leg, gets stuck there. That's more the physiological reason why. But here's how it ends up happening. So you might be seeing this and saying, wow, those foods, those are things I like to eat. Maybe not liver so much, like I don't know. I'm not a big liver person myself. But if you look at all these other drinks, these are things that people like to have, like soft drinks. I literally have a Diet Coke here. I love Diet Coke. Um, if you send me a bunch of Diet Coke as a payment, I will accept it. Like, I'm not kidding. I love Diet Coke. Anyways, but soft drinks, not ideal to be having alcohol. Obviously, alcohol has a bunch of other issues that it can cause as well, but seafood and red meat. So that's another one. So liver kind of falls in that, but it's not, I don't really like to consider that a red meat. That's like an organ meat. Red meat, we would think of like cows and stuff like that. So those are the biggest ones. If we just want to like kind of recap, red meat, shellfish, oysters are unfortunately the worst, and alcohol. So you think of like, oh, I'm going to a nice steak dinner and I have my oysters as my appetizer and I have my, beer or whatever as my drink. Yeah, that's a recipe for gout. So you might see all this and be like, my dad likes to eat and drink all of this stuff. Yes, it affects males more than women. So older males is the most common population that we would end up seeing gout show up with. So basically, you're just overdoing it, all of this stuff. Uric acid builds up. It's the same kind of thing as if you have too much calcium in your diet, and then it can cause urinary blockages where you could end up having a kidney stone or something. Same kind of thing, concept wise, with this. You have too much uric acid, it builds up, it gets stuck somewhere. It likes to get stuck in the joints. So that's kind of what's happening here. Again, just knowing the foods that can cause it, pretty good idea. It's essentially high purine foods that also contain uric acid. So that's the biggest thing you'll have to know. But here's how it'll look on typically you see this red swollen joint. So I like to think the toe. Gout has a T, there's its toe. That's a big thing that I like to think about. So it usually pops up on the big toe here. You can see there's redness and swelling. Now, this is a darker skinned individual, so it's a little bit harder to see, but if you can see it on a darker skinned individual, you can see it on a fair skinned individual. I think a lot of times we're not shown as many pictures of people who have darker skin, like in our textbooks. It's all people who have light skin, and it's really easy to identify redness and swelling on light skin, but this, not as easy to identify, but you kind of see what I'm picking up. They're picking up what I'm putting down. So again, you see the redness and swelling, warmth and pain, this like lumps. You'd also see the tophi present, and not so much seeing it, but like if you palpate the joint, first of all, it's really gonna hurt, but you'll feel it feels like crunchy and crusty. That's the best way you can describe it. But the boards will describe it as redness, which is also referred to as erythema, warmth, swelling. So you'll also see edema present and just seeing that it's just enlarged around that joint area. Now, again, they're going to lack range of motion because when you have swelling, regardless of what kind of swelling, you lose range of motion. So that's going to be an issue. And then walking will be painful. Any sort of weight-bearing activity will also be painful for these individuals. They're not having a good time. Their toe is not doing good. So essentially, how do we treat it? We as PTs, PTA people, we are not going to be so much like treating gout, more so just once we're able to getting range of motion back, working on weight bearing, all of our ADLs and stuff like that, modifications of exercise and whatnot. We'll document pictures if it looks like it's getting worse or better, kind of thing. But a lot of times when we see this patient who has gout, we're more also kind of treating them for the other things that might show up. So they might have the gait deviations from the antalgia. They might have weakness on that side from disuse. So we're kind of adjusting those sort of impairments. Sometimes if we're treating a patient and they end up having a gout flare up, we will end up sending them back to their doctor to obviously have that be assessed. But in really bad scenarios, they might need surgery. But the biggest thing that we can talk about, and this is what the boards will ask, is what is the most common treatment for gout? It's going to be don't eat these foods that cause it. So don't eat all the shellfish, don't eat the organ meats and red meats, the alcoholic beverages, the soft drinks. Like avoid those if you can, or eat less of it. And eat more fruits, vegetables, whole grains, low fat dairy, legumes, and nuts. Basically, they want you to poop better. Think of the foods that make you poop better. That is the foods you would eat to not have gout. But anyways, basically we're just mitigating the uric acid. It's the same thing if we have somebody who's having too much calcium in their diet and they need to drink more water to avoid kidney stones. That's the best way I can think of it. So again, with this, just pick the foods that are lower in uric acid, avoiding these big foods that have a lot of uric acid in it, which will just accumulate in the body and then show up. There's another condition called pseudo gout. Basically, it's just the swollen joints, but it's not so much the uric acid. That's a separate thing. Not so much about knowing the difference between the two, but if you're seeing the tophi, the uric acid buildup, the crystals, that's true gout. If you're just seeing like the swelling and an inflammation of a specific joint, that's more along the lines of pseudo gout. So just to kind of know the difference between the two, but most of the time the board's going to talk about just regular gout because we can modify the diet and offer, dietary advice. Keywords again, uric acid, maybe the presence that they said the patient's been eating a lot of like steaks and drinking wine and has oysters on the weekend. Yeah, that's all going to put them at risk. The tophi, so the presence of the tophi, as I was saying, the great toe, first MTP joint, big toe, foot, that all the warmness and redness again, this is not the warmness, redness and swelling. Remember, you might see this and be like, wait a minute, what about a DVT? Here's the thing, when we're looking at questions, they're gonna give us enough information to get the answer correct. If we just said warmness, redness, and swelling, it's like, well, that's not enough information to tell us one way or the other. We're saying, oh, there's presence of tophi. Boom, that's gout. Or hey, there's a severe pain when we palpate and they just had surgery. Okay, well, that's more of a DVT. Do you see what I'm saying? Like, they're going to give you enough information in the question. They're not just going to say, you have warmness, relling, and redness and swelling around the joint. Okay, that could have been a meniscus tear. Like, who knows what's going on? They're going to give you enough information. So don't worry. You're going to have enough information to answer these questions correctly. But for gout, uric acid, the high purine foods of the liver, red meat, wine, shellfish, tophi, great toe, warmness and redness surrounding the joint, and the swelling as well. Those are all our key words. So, a patient is being treated in outpatient orthopedics for rotator cuff impingement. The patient also has a history of gout, which has flared up. Assuming the common location of gout, what activity would need to be modified during their session? 1. Supine shoulder flexion with dowel. 2. Standing wall slides. 3. Seated pulleys. Or 4. Sleeper stretch and side lying. So, give you guys a moment to think about that. Okie dokie, guys. So our answer is going to be standing wall slides. So the question is saying, see, we have a patient, something else is going on. They just happen to have a gout flare up right now. Okay, if they're used to it and they've had it a couple times, they probably have medications or they've had treatments set up from their doctor that they know how to manage it. But they're still coming in. They had the rotator cuff impingement. And they want to have their shoulder feel better. They're like, man, I only want one joint to be hurting. I don't want two. I still want to get better. Okay, well, we can still do their therapy session. We just might have to modify things. Basically, if we're assuming the common location of gout, we're thinking big toe. Okay, so I'm telling you, assuming the common location of gout, which means you have to know where is it most likely to show up. Big toe. Remember, gout has a T, toe. So, because of that, we're thinking, okay, yeah, all those weight-bearing exercises, those are probably going to cause more pain. So, let's not do a weight-bearing exercise. Supine shoulder flexion with dowel. They're laying on the table, non-weight-bearing. Still good. We don't have to modify that. Standing wall slides. Okay, they're standing up. Should probably have them potentially do it like a seated like towel slide, or maybe even just have them seated and going up the wall, like get them off their feet because that might be painful. So we would have to modify that. So that's why number two is the correct answer. Three seated pulleys. Okay, they're sitting down, they're not weight bearing, not a problem. Sleeper stretch and sideline, they're laying on their side, they're non weight bearing, not a problem. So hopefully this makes sense, guys. A lot of times you'll see gout show up with something else going on, but just knowing about the modifying the food and where it's most likely going to show up is like the most important thing. All right, guys, I will see you on the next one. Take care. Bye.